Hello everyone, welcome to GMC News. Today's story is about acroporphia or Fabry disease. Another common name for this disease is lysosomal storage disorder. Fabry disease is caused by mutations in the GLA gene, or the 22nd gene in your chromosomes. This gene provides instructions for making an enzyme called alpha-galactosidase A. This is a disease that affects the hands, feet, skin, heart function, hearing, and eyes. It can also reduce the amount of sweating, which can result in internal overheating. Strenuous activities such as sports, exercise, etc. can be dangerous if the necessary precautions are not taken. Now on to Michael.
As she said before, Fabry disease is a disease that affects the extremities by causing mutations in the glycophospholipids metabolic pathway. This causes the buildup of global triisomerase within lysosomes. In other words, this is the buildup of lipids in tiny vasculature of the GI tract because the blood vessels leading to those parts are being deprived of blood, especially in the skin, kidneys, heart, brain, and nervous system. Fabry Fabry disease is also linked to damage of the peripheral fibers that transmit pain. People can experience very severe pain in their hands and feet that gets worse with age. They can also have hearing that's gradually lost or sudden hearing loss. Painful rashes known as angiochrontine or abnormal heart size, irregular heartbeat, and abnormal appearance of the surface of the eye. This is called cornea verticillia, and only 75% of people get this. Now on to Mark. You are a distraction, I swear. You are.
Not great. Thank you, Michael. Fabry disease is a rare disease which generally affects 1 in 117,000 people in 1 in 40,000 males. This is an X-linked trait, so it affects more males than females. It is a difficult disease to diagnose because it does not only have one major symptom. In order to be suspected of having the disease, then you would have to be found with many different symptoms. Symptoms usually develop in adolescence or early childhood. There can be a misdiagnosis because of the many shared symptoms of other diseases and disorders. Most of the time, the initial signs of the disease are itching and burning sensations in the hands and feet, which get worse during exercise and hot weather. Now on to Laura for the symptoms of Fabry disease.
Thank you, Mark. Some symptoms of Fabry disease can include pain in the extremities or the GI tract, which can be caused by accumulations in tiny vasculature of the GI tract, damage to the peripheral fibers that transmit pain, a painful red rash that occurs between belly button and knees, but can also be found on the hands, tongue, and toes. 75% of sufferers have cornea verticillata, which is when the surface of the eye appears to have an abnormal shape, but this does not affect vision. Developed or worsening hearing loss, increased heart size or abnormal heartbeat, or other symptoms or health conditions could increase the amount of heart complications. Fatigue, heart or cold intolerance, reduced sweating, or episodes of intense pain in the hands or feet. Fabry disease mainly affects this part of the body, but by causing a tingling, burning, or pricking sensation caused by nerve compression.
This disease is diagnosed depending on the gender of the patient. Women will need to have a genetic test for an accurate diagnosis because they have a normal amount of alpha-galactosidase or GAL in the blood, but still carry the defective gene. The X activation pattern may be different in the different organisms. The males will have a lack of alpha-GAL activity that shows they have the gene. Men can be tested through the blood test called the enzyme assay that measure the alpha-GAL in the blood.
Some treatments for this disease include enzyme replacement, anticonvulsants, and metoclopramide. Enzyme replacement helps with slowing the progression of the disease. Anticonvulsants, such as phenytoin, a treatment for seizures, and carbamazepine, which is a treatment for types of seizures, nerve pain, bipolar disorder, and manic depressive illness, all help with the pains in the hands and feet. Metoclopramide, a treatment for gastric esophageal reflux disease, nausea, vomiting, and heartburn, can help with the gastrointestinal hyperactivity. However, some patients may need to be put on dialysis or have kidney transplantation.
The lifespan of people with Fabry disease is reduced by about 20 years, with a mean lifespan of about 50 years. Birth mortality rate is very low and most likely does not affect the pregnancy. Now to Laura with the real story of a family with Fabry disease.
Thank you, Mark. This family of three in Berlin, Germany is a real-life story of a daughter and dad with Fabry disease. Dad, Gerald, was diagnosed with this disease in 2006 when his kidneys suddenly started to fail him. He received a kidney transplant, which led to the ultimate diagnosis. Mom, Mara, must have been a carrier for daughter Geraldina to inherit this X-linked disease. Geraldina was also diagnosed with child disease.
Thank you, Laura. This is GMC News saying goodbye. Thanks for watching our video on Fabry disease. Bye!